start the meeting. And this is on banning the original. It's shutting off now. This is banning the drug, the ordinance that came before the council. I think we passed the first step, Helen?
Yes, you did.
And then, but then it was referred to committee. I think this was referred to committee.
It was.
And then Sean, this was his ordinance that he came in with, but he didn't get reelected. So this is basically starting over again with a new council. And this would have to, what would be the procedure here, Helen, now on starting all over again?
We are, because first step did pass, but first step passed on the old ordinance, and the old ordinance, it was determined, did not go forward. So we would have to start with the legislation again.
So I think what we should do is start with the topic. Where do we stand with banning? Should this be banned, and why it should be banned? And I think if I read my notes correctly, there's a 70H that, and you're from Washington, DC, Allison?
Yes.
And
Hi.
you could just introduce yourself?
Yeah, absolutely. So my name is Allison Smith. I'm the Director of Government Affairs for the Global Kratom Coalition. I drove up from Washington, DC to be a part of this conversation. And our organization is focused on protecting access to natural kratom leaf products while trying to ban and prohibit concentrated synthetic 7-OH, which, as we discussed previously, concentrated synthetic 7-OH, that's what your quote unquote gas station heroin is. That's 13 times more potent than morphine. It's 100 times more potent than the natural product. And it's dangerous, and we need to get these off the shelves.
Now, Helen, right now on the shelves in gas stations has the 7-OH product.
That's correct.
And it's my understanding that people are getting very sick on this, and they're actually dying from overdosing or a blend of other drugs involved with this drug. So what should we do?
Well, we're starting at first step. As you know, I gave you a synopsis of what the Public Health Council, who has taken this up. I know Dr. White is on the call. However, I think both the Public Health Council as well as the City Council has heard from Dr. White. So we've seen that presentation. I guess I'm wondering, Counselor, and this would be your call, whether it makes sense just to go around and kind of hear what individuals are thinking about as far as this, as kratom is concerned. I will let Dr. Colgraham speak for the Public Health Council, although I've given you the notes that we have from the last meeting. So it's up to you, but I do think we now in a position to hear the voices that have tuned in with us.
I'll follow your direction.
Okay, all right. Okay, so why don't I start with Dr. White. Dr. White, are you with us?
I am. Hi, everybody.
Hi.
We have all seen and heard your presentation. You have looked at the current ordinance as it stands. I know that you have made some recommendations as far as revisions are concerned. So I wanted to just start with you and ask you, I think we all agree that 7-OH should be banned. I think there's universal agreement on 7-OH being banned. But do you have any concrete recommendations that you want to share with us as we move into this next phase of creating a new ordinance or revising an ordinance?
Yeah, first, I think that this amended ordinance is really good. I think it has come a long way to the form that it currently has. There were a few things that I thought could be added to it in order to strengthen it. So if there's general agreement that an ordinance, like this should be moving forward, I'm happy to talk about, what some of the fine tuning things that I saw would be.
Thank you, Dr. White. Dr. Colgraham, you sat with the Public Health Council. I know Dr. Kriesman is on the phone as well. So if you could maybe talk to us about what you heard as far as the council is concerned, and as a physician, any recommendations that you might want to bring forward.
Hi, everyone. My name is Dr. Sharon Colgram. I'm one of the newest members of the Public Health Council. So I came in right on time in terms of trying to understand the ordinance for the kratom. And basically, what I understood from our discussions at the Health Council was really focusing more so on defining uh, natural kratom versus 7-OH, and then was there a difference in terms of the toxicity and the risk of dependency, and the risk of overdose. There wasn't much data on that, and so my suggestion to the council was to really get some feedback from people that are actually doing the work, that are boots on the ground, working with people in this space, which is why I reached out to my fellow colleague, Dr. Eric Kreitzman, and he can kind of explain his title in the community. The other concern that the council had was really focusing on what kind of good harm safety measures we could put in place. There was a lot of concern about access, just general access. There's no limitations on it in terms of who can go into the gas station to see it, any signage, any data or labeling that says there's risk of dependency. So those were some of the major concerns. The other thing is also in what is the goal of the prohibition, and how would banning the kratom, whether we're doing natural kratom 7-OH just based on what Dr. Kreitzman said, and completely banning that, how do we affect a subset vulnerable population that has been left out in terms of having access to alternatives or medications that help with pain control? So those were kind of the summary of what was coming from the Public Health Council. So from that conversation, and let me know if I miss anything, Commissioner. But from that conversation, that's when I reached out to Dr. Kreitzman, who kind of enlightened me on some things that I wasn't really thinking about. And so since he's here, I'll kind of let him kind of lead that area as well.
I am not seeing, Dr. Kreitzman, are you there?
I'm here. Can you hear me?
I can hear you. I'm just not seeing.
I might be on the next page of the screen, perhaps.
Oh, okay. So okay. All right.
Let me know when you can see me.
I can't see you yet. Maybe it's because to the right, there's the,
Yeah,
I don't know if that can come down, or Dr. Kreitzman can be.
I see his name up there.
I can see
Yeah,
him.
he's here. I think it
Yeah.
might be the television in Focus Springfield.
Yeah.
It's blocking the screen.
Well, we won't be able to see you.
Okay.
I know that as Dr. Colgram explained, the Public Health Council has reviewed this. We put a paper out on it in terms of what we came away with. And thank you, Dr. Colgram, for explaining it. A part of it, though, had to do, if I recall correctly, with addiction and how the impact of kratom is as far as addictive behaviors might be concerned. So, Dr. Kreitzman, that's the piece you're going to address. Is that correct?
Sure. Yeah, I'm happy to answer anything, any way I can be helpful. So I'm Ari Kriegsman. I'm the medical director for BHN's Springfield opioid treatment program, so our methadone program, and also Carlson Detox Center. Yeah, I'm trying to think of what to share first. What I'll say is, you know, kratom and the derivatives of it are opioids when used at higher doses. So I treat a lot of people for opioids in the Springfield area. I don't see a lot of people coming to me for help with kratom. I would say in our sort of programs in the last year, maybe we've seen 10 or 15 people who come to me for help. I think a lot of the people who use kratom are using it really, as we know, outside the medical world. And I think it's hard to know exactly how many people are using it and getting benefit from it. I think there's really broad estimates and nobody really knows for sure. And not many people are showing up needing help. But when people have showed up needing help, they can be in rough shape. They become dependent on it. If they try to stop it, they get very sick and go through pretty significant withdrawal. Um, and so I think that's sort of a brief synopsis of and I think there's always the piece of perhaps as it's more and more available, might we see more and more issues with it. And then I think along those lines is I think the 7-OH or the derivatives that are, more potent are probably becoming more and more available. And, I don't see people when they overdose and die, they end up more in the hospital. I think kratom related overdoses have still been really low, especially when it's just kratom alone. I think theoretically, and probably we'll know more in 6 months or a year, probably like we'll have a sense of how many people are really overdosing and dying from 7-OH. I don't know that. I think it is more potent, it is more risky. Um, what I'll say is, there's so much thought that's been given to the opioid epidemic for good reason, right? Like we've had over 100,000 people die in a given year in this country from overdoses, and that's gets a lot of attention appropriately. Excuse me. Sorry about that. And so it's interesting because kratom and the derivatives are opioids, and I think we need to take them very seriously. But we don't have a great sense yet of like how that, what that's like compared to fentanyl, right? So fentanyl is up here, kratom, even 7-OH are way down here. That's not so that's just to give some context for it. And just sort of the flip side to say, just to like you still need to be 21 to buy alcohol, you need to be of age to buy tobacco, and the fact that anyone could walk in and get these things. So, yeah, I don't know that I'm going to be here so much for a political position, but I think we could definitely come a long way at the very least in terms of like education and signage and all kinds of harm reduction measures. And I'll leave it to y'all to sort of decide what to do with the law. But I'm happy to be here to answer any questions.
I have a question, doctor. How is this being blended in with other drugs? How does it get in, like in a toxology report, you may see fentanyl mixed in with this. How does that happen?
I think that's just somebody who's using multiple drugs in the same day. And so I think, yeah, I think it's just people are using multiple drugs in the same day. So similar to how you might buy alcohol from the store and you might buy heroin from your dealer, use them together, increases your risk of overdose. But when you show up in the hospital and, they're doing a post-mortem, they'll find evidence of both there.
All right, can you focus again? Because I know I had a question to you in terms of, and I think you kind of said it a little bit, but just really in terms of the toxicity in comparison to fentanyl versus like a Suboxone, like where does it fall? Because I feel people are thinking that it's very dangerous, but in terms of what you're seeing, like where does that fall?
Yeah, I would say that like a toxicity or say risk of overdosing and dying, kratom is probably somewhere like Suboxone, which is what we use as a treatment for opioid use disorder. It's Suboxone, if you're not familiar with it, has some things in common with methadone. We use it in similar ways. But what makes Suboxone very safe is it's very hard to overdose and die in it. If someone had no tolerance to opioids, they'd never used it before, they had other medical conditions, it's possible to overdose and die on Suboxone, but it's also a treatment. So I would say kratom, the natural leaf, is probably somewhere like that, and its derivatives. We don't know exactly for 7-OH. We know it's much more potent than kratom. It probably also has some ceiling effect to it, meaning that you can hear that's, maybe 13 or who knows, 20 times more potent or however many more times potent than the kratom. But it's probably still has some ceiling with which it makes it. Anyway, I hope I'm not making things too muddy here, but they're still significantly less dangerous than fentanyl is.
Yeah, but doctor, why would somebody have the 7-OH on the market? What benefit does that have?
I think people will try it. They'll feel more effect, higher from it. Yeah. So just more effect overall. And so I think people are probably using the natural leaf kratom for a few different reasons, right? Some people use it to treat their probably mental health stuff. Some people use it to treat pain. Some people use it to come off of opioids. And then some people might find that they like it and they become addicted to it. And then you get something that's more potent. So for all those things, it's stronger.
Okay, yes, sir. Introduce yourself.
Oh, yeah. My name's Joe Van Wart. I'm just local to Massachusetts. I do work with a lot of stores, more than 200 locally, and this has been an issue where, where is the regulation coming from? And to my knowledge, whole leaf has always been safe, but then these extracts and synthetics came on the market and they're right next to each other. You have somebody getting whole leaf kratom and it's, 100 parts per million or less next to another thing that says kratom, but it's a synthetic and it's 4,000 parts per million or more with 7-hydroxy being the main ingredient. And people are taking those and that goes to your opioid receptor, the 7-hydroxy and can, affect your breathing, slow your breathing down. It's very dangerous, just like an opioid when you take too much of it. But the natural leaf kratom, you would have to have dozens and dozens of doses to even touch a fraction of one of those doses of 7-hydroxy. So you brought up a good point. People would take natural leaf kratom, but then they're also taking 7-hydroxy. And when something's 4,000 times stronger, someone needs to be educated on that. And there is really no knowledge that people know of. So someone has brought up banning synthetic and extracts because there's no regulation, where natural leaf is just the natural leaf. And federally, it's been mentioned nationwide, it should not be an issue. And I think the FDA held up, a sign saying these are accepted and these are not. And there is a chart that they've started with. And to say Springfield, let's look at that as the starting point, and say, at least let's start with that. Never mind letting other stronger things in. Let's stop right there at 100 parts per million, no more, and say that's our regulation. And these are our manufacturers that meet that criteria. And like you said, people aren't coming in for it yet. But when people are taking 7-OH at high doses, the issues will come because now more competitors are coming in the market because it's been allowed. So you'd say, let's stop that now before problems do occur. And natural leaf, you won't find that problem because scientifically it's not there. So
I'm just going to interrupt because I think I agree with a lot of what you're saying, but I think you might be just oversimplifying it a little bit. So,
well, yeah,
the natural leaf at moderate to high doses is an opioid. You can become dependent on it. You can go into significant withdrawal when you stop it.
How much would you have to take, and where would you get that natural leaf? Like, what would it look like?
If you took a number of servings and they come in different concentrations, but you'd need to take a fair amount. But I've met people for sure who started with natural leaf, only took the natural leaf, became dependent on it, and went to withdrawal without it. And so I'm not saying that we shouldn't that should be banned. I'm not here to sort of make political peace, but I just want to be clear that you can for sure become dependent on the natural leaf alone. And I think that's an important piece of education.
Yeah.
So I think it's a lost point if you say it has no risk to it.
No, not at all. Same thing with caffeine. There is that addiction point, and then if you take too much caffeine, it doesn't have the same issue that opioids do, which is significant. People should recognize that. But there was a study just recently done, and it is public. And I think it was a 10-day study where natural leaf was given, and they showed an improvement in cognition, not, a regression. And the withdrawal symptoms, I believe, after that study, and this is public information, you can find it, it's new, so it should be shared with natural leaf, that there really was minimal to little withdrawal symptoms. Now, like you said, when you keep upping it, and I eat, say 2 to 3, 4, 5, 7, 10 doses a day, like anything, it should be, people should be aware of it. And if I don't have access to the 7-hydroxy that's 4,000 times stronger, it's less of an issue versus I find natural leaf and then, hey, there's the 7-hydroxy that's 10,000 times stronger. I shouldn't have access to that. So if I do have a problem, I would have to consume so much natural leaf that it would be a hindrance. And that's where I think regulation almost naturally would occur.
So I'm gonna, if you don't mind, we have a visitor from Washington, D.C. who drove all the way here to be a part of this conversation. So if I can ask you, I'm sorry, Council.
No, go ahead.
You know me well.
No, go ahead.
So if I can just ask you to just talk about your role, talk about the thoughts from you're from which organization?
So I'm from the Global Kratom Coalition. We are a nonprofit. We're an alliance that works with consumers, providers.
Excuse me once. Can you all hear?
Yes.
Yeah.
Okay.
Fabulous.
Go ahead.
Sorry, I guess I'm speaking quietly and turned away. But our entire goal is we're trying to allow for regulated adult access to natural kratom. We view natural kratom as anything less than 2% 7-OH concentration, and then anything above that we're trying to prohibit because we consider those a concentrated synthetic 7-OH. Our view is that anything that's below that percentage is not even considered kratom. We call that 7-OH or something else. It is not even the same because it's not natural. You will not find that in nature. It has been taken into a lab and adulterated in some way, shape, or form for potency. And to answer your question earlier, there is a financial incentive when you're putting out such an addictive product. People are going to go back and spend XYZ amounts of money on these little tabs, not knowing the full effects of them. And I will say, there is research that's been conducted on the habit forming capabilities of natural kratom. I'm happy to find that and I can follow up later. It's addictive in the way that caffeine is. When you have quote unquote withdrawals, headache, maybe a bit of a runny nose, it's not like you're going to have, seizures or like type really intense withdrawal symptoms when you suddenly just stop taking natural kratom. There's also a plethora of studies that I can provide with you guys. We actually have like a one-pager that lists, I want to say like 17 or 18 studies that have been done in peer review, clinical studies that demonstrate the safety and efficacy of kratom. But I just wanted to put that there. Do you have any specific questions that I can try and answer?
Well, one of the physicians who's on the Public Health Council said there was an acknowledged uncertainty regarding natural kratom given the lack of evidence-based clinical trials and long-term data alongside anecdotal reports of potential benefits, particularly within harm reduction context. So this physician, and he wants to come himself, he's seeing patients right now.
Yeah.
His question really is the evidence-based clinical trials have not happened with natural kratom.
So first things first, more than happy to participate in a conversation at a later date with him if you would like to chat about that. We can connect offline. Secondly, so natural kratom, the leaf in its dried forms and teas is usually the most common form it's consumed, has been used safely for centuries. Came over here from Southeast Asia, and in the 1970s, it was introduced to the United States by veterans from the Vietnam War. There's no evidence of deaths or adverse events over in Southeast Asia. And if they are minuscule. There's usually a pre-existing health condition or poly drug use. That's the typical standard, but hundreds, if not hundreds of years of safety for natural kratom products. Regarding studies, again, I'm happy to provide that list, but a key one that I like to point out is the FDA actually conducted a study last year or 2 years ago, 2024, called a single ascending dose study, where they took, adults, healthy, 20 to 30, 40 years old, and gave them different levels of natural kratom, going from 4 grams to like 12 times your regular serving size. And they didn't report any adverse effects. The worst thing that they experienced was a bit of a tummy ache and some nausea. And that's because natural kratom has a threshold where if you consume too much, you're going to get an upset stomach and your body's going to try and reject it. So when you hear of these cases where people are consuming copious amounts of kratom and possibly overdosing, a natural kratom plant, if just as a capsule, because they have like little powder capsules, you'd have to consume like 72 of them to cause harm, and your body you would get sick and probably throw up around 24 or 30, I would argue. So it's very hard to harm yourself on those products. You kind of have to try. But yeah, so with that, I'm happy to provide the list of trials and we can discuss that further. But the FDA one is a big one. And there's plenty of other ones that I can share with you.
Now, MDAR, and that's the Massachusetts Department of Agricultural Research, have not given us any regulations around kratom. We have it for synthetic cannabinoids. There's something that they've given us. Natural kratom doesn't seem to have been studied by MDAR or given any feedback for us, at least.
So it's relatively new on the scene in the sense that I can speak for myself. I didn't know what kratom was until about a year ago. And that's because of these concentrated synthetics. It hasn't become a problem until these 7-OH products hit the market. Now people are becoming addicted, they're overdosing. Unfortunately, some have passed away. And now the entire industry is asking for regulation, because there are people who get benefits out of natural kratom use, and they don't want to see those products lost because bad actors came along and used a federal loophole. So to answer your question about research, that's part of the reason why it hasn't really been something of concern until very recently. That being said, looking at this, these key points that you included, I mean, these are all fantastic. 21 plus age gate requirements, put it behind a glass shelf, require an ID to purchase these products. I love the idea of limiting child appealing packaging, keeping away cartoons or anything like that. We don't want kids ingesting this. That's messed up. It's the same thing with synthetic cannabinoids. And then with warning labels, I'm sure there are like federal requirements for what is supposed to be listed on like natural kratom products. It's treated as a dietary supplement. And so there are, I can give you the specific language. I don't have it off the top of my head, but we can absolutely, and I'm happy to provide municipal draft regulations that we've worked on. I've worked with a variety of organizations across the country to help get kratom regulation implemented with what works for their resources.
Question.
Yes,
Are you in favor of banning the 7-OH?
absolutely.
Okay,
Absolutely.
and here's my concern. If we ban the 7-OH, what about the black market that pops up?
Well, that's every black market.
No, I'm just asking that question.
Yeah. You.
Go for it.
Oh, go ahead. So, in regards to that, so you ban something and it's gone, you ban alcohol, where does it go? So alcohol is allowed, but you can't buy, 100 proof alcohol, right? Where do you buy 100 proof alcohol or 100% alcohol, straight grain alcohol? But liquor stores are, able to sell within the margin.
Mhm.
And then regulation kind of settles itself in the market. If you banned 7-OH, you'd be in the same position you were before it was allowed in the convenience store. People found things like that, and 7-OH goes away, the manufacturers will go away. The only reason 7-OH manufacturers are here is because they're allowed to sell at scale. When they go away, the black market won't even entertain them. There won't be the same money to be made, I don't believe.
Mm.
So when you put the regulation in place, you'll see
What's the name?
Mr. Chair,
by the way.
I'm sorry.
Counselor Govan?
Thank you, Mr. Chair. So yeah, I'm with the young lady that traveled all the way from Washington, D.C. to join us. Thank you
Yep.
very much for coming out in
course.
person. I hope you
Happy
love
to be here.
Springfield.
It's been great so far. I really like it.
But I am like her. I have not heard of Cradium until we started talking about it at the city council, and until people started emailing us about it.
Yeah.
And I have been an addictions counselor and clinician for almost over 30 years. So I feel like this is something that we always get new things in the market. Fentanyl, right, came on and devastated us. So I'm really, I guess, glad that we're looking at this early from us just learning about it. And I also, I guess want to caution us about alarming people and making things
Mhm.
scary, because of course we don't want children ingesting drugs, we don't want children ingesting alcohol, tobacco, or any of that, and so we want to make sure we protect our children and our adults in our community. From what I understand, the HOA is what we're wanting to ban, correct?
Mhm.
7-OH.
Anyone? Okay,
7-OH,
the
yeah.
7-OH.
Yeah.
So right now, someone can help me understand what's happening. So right now, people are going into convenience stores, gas stations, and buying 7-OH. Is that what
Yeah.
I'm hearing?
That is correct.
Correct. Okay. So that's what we want to prevent, correct? And then how do we do that? So I think Dr. White was going to be looking at the ordinance to see how we can word it so that we can protect our community, correct? And
Yes.
then
Yes.
we have to figure out a way to continue. I like what the young lady said about studying it, because this is like marijuana, right? For the longest time, marijuana has been illegal in this country. And because of that reason, we haven't been able to study it. And we know that marijuana has some really good medicinal benefits. And I want us to be able to do that. And if this is something with the kratom that we can do, I hope that we are able to study it and to find out what the benefits are. As an addictions counselor, I'm going to say, and a person in long-term recovery, I feel personally that any substances that have the potential to be addictive are dangerous, because a lot of times when people get addicted to a substance, the substance may stop working after a while because of the compound effects of the drugs in the system, where the system gets used to it, and now you need more, or you need something different. So that's all goes in line with the disorder. And I know that harm reduction has different language, but I'm from the old school, and I believe in recovery, and I believe in, finding ways to help people figure out why they need to use a substance, right? And it could be pain management, and that's okay. But if people are suffering from other ills like depression, anxiety, and other things, which a lot of times people self-medicate for, and they'll use alcohol, they'll use marijuana, they'll use cocaine, or heroin to kind of like treat those things. I want us to make sure that, we're able to sort of differentiate somehow and lead people in the right direction, right? If you're using a substance for depression, then maybe you might want to see a therapist. You might want to see a psychiatrist where they can help you in a healthier way. So I just want us to be cautious about this. And I'm really glad that we're here having this discussion, and that we didn't necessarily put the ordinance through the last time, because we were getting a lot of contradicting emails, people telling us how wonderful it is and how we have to make sure that we keep it available. And then others, of course, were telling us about how their children overdosed from it and died. So I want us to be real cautious about how we move forward, and make sure that we understand what the benefits and the risks are when we're talking about kratom. So thank you,
that's
Mr. Chair.
Yes, and counsel, that's why we're having the meeting. You're correct. What my question is to Helen and to our law department: why isn't the state banning this? Why are they looking to cities and towns to individually ban it? Why aren't they banning it?
Well, there are two bills before the state legislature, both addressing this in very different ways. But there are two bills at the state, and I believe there's one at the federal level that was last year that got stalled for whatever
Yes.
the reason.
Yes, so there are bills at the state legislature that are addressing this, and like you said, there's a variety of ways they're looking at implementing regulation. At the federal level, there are a couple of bills that are being considered. Nothing that I know of that's been introduced in this Congress. However, I will say, and I believe you mentioned this, last year, HHS, FDA, and the DEA announced together that they were going to look at putting concentrated 7-OH on the schedule. And last week, the president and Secretary Kennedy Jr. had a press release where they talked about addictive substances and wanting to move in the direction of helping with addiction services on a variety of levels. But they mentioned the concentrated substances and the need for it to be banned. So there is both state action and federal direction. Fortunately, it doesn't move as quickly as it does at municipal levels. But I will say, looking at what you guys have proposed, this does align with what the federal action is at the very least. And I think that's a good step in the right direction, and then amend as needed where we can.
And
And
this
you're
was,
talking about, I want to be clear, you're talking about the paper you have from the
Yes,
Public Health Council.
yes. So
But you have not read our ordinance. Have you seen the,
I haven't seen the new version.
There is no new version. You
Okay.
haven't seen the old version or.
So I saw the one that city council considered and didn't
That's new.
pass. So I don't know if there's like a newer version that you
No,
guys are
there
looking to
isn't.
amend.
That's just want to
Okay.
make sure.
Okay, fabulous. Okay, then it's the same one. Then yes, that's the one we
Okay.
really liked, the 21+ age gating, the keeping packaging from being attractive to children, and then the 2% threshold to differentiate between what is natural and what is considered a concentrated synthetic 7-OH product.
Thank you.
Yeah.
Just to get back to Helen, at the meeting, you did say at the meeting that you didn't have the wherewithal at that time you made the statement of enforcing it. Where are we now?
The enforcement had to do with testing, if you remember.
Yes.
It, in the original ordinance, it has us testing, as a city. That was going to be extremely difficult, for the city and for my department in particular. So, do you have a position on testing? I heard you talk about the 2% threshold.
Yes.
Right, for natural kratom. I think 7-OH, I think we all agree.
Yeah,
Everyone in this room
Get rid
agrees
of it.
needs to be banned.
yeah.
Natural kratom, I heard the 2%. Labeling is required
Yep.
currently, and so there is no testing that would need to happen with natural kratom. Is that correct?
No, there shouldn't be. It would be, well, if it should be under the 2%. That being said, if you wanted to, and I can work with you on language for this, any sort of retailer that wants to sell a natural kratom product could provide third-party testing to be able to like submit an
They
application.
would have
be
to
able
provide it.
Yes, they
So
would.
it would not
Third-party
be, it would
testing.
not be on the city
Yes.
to, okay.
Yeah, yeah.
So that, I think that was my challenge with the old ordinance,
Yep.
is the testing.
Yeah, absolutely. Put the onus on them to prove that their product is safe for public consumption within these regulations. I think that is absolutely reasonable, and feel free to verify this, any good provider that actually is, not creating these concentrated substances, they're going to provide that information. And if I can elaborate too with packaging, it's blatant, the difference between what they're selling. You have these brown powders, capsules that are very clearly like an herbal natural supplement. And then you have Cheech and Chong's cosmic glues, which is very different in the intent of what the product is. So feel free to.
And milligrams have to be listed. And if they put a slash so they don't tell you how many milligrams, it is not allowed to be sold. Should be the requirement. So like I work with vendors and they say, how do I know? Look right on the back. If it's above 2% or above this milligram level, it should not be sold in this store. And every store owner needs to be held accountable to managing what comes in their door. They now work with you to regulate citywide. These do not come in the door.
Where are you from?
Massachusetts,
Where in Mass?
Norton, Massachusetts.
Martin?
Yeah. I went to school at Westfield State.
Did you?
Yeah.
Okay, you're an owl.
I am.
I appreciate your directness, but I don't believe anything you just said.
Oh,
Because- No, no,
Could you introduce yourself,
Yeah,
please?
sure. I'm
Very nice to
Steve-
meet you.
I'm Steve Bonacani. I'm the city solicitor.
Oh,
Lobbyist.
No, I just do
You work for
government
the-
affairs.
What do you work for?
I work for the Global Kratom Coalition, so we're a nonprofit.
Lobbyist. What do you again?
I work with Circle K. So like it's a gas station, right?
Yeah.
So they go to
So
me.
you're an emissary of Circle K today?
No, because I work with 200 different stores. So Shell I'm an independent contractor. So I'd say, they asked me, can I carry 7-OH? Can I get that from you? I said, no, I don't believe in 7-OH. So when they want other products from me,
And then they go somewhere else.
they go somewhere else because they're allowed to,
I
because
understand.
those guys exist.
So the idea of putting the onus of almost of like that you're going to have a responsible seller out there in
Yeah.
every little bodega and convenience store.
Is going
in
to carry
South
my
Springfield.
product. My 7-OH is going to go in 300 stores tomorrow. Oh, wait, now it can't. Why would I even manufacture it? Am I going to sell it to every Joe Smith on the corner to sell it? That's not going to be lucrative. Business is now shut down. Do you know what it costs to manufacture that?
No, but I can understand this. What we are chasing, we're playing whack-a-mole. in the
Mhm.
city.
And this is what shuts the funnel down.
Well, you go quickly to the shutting the funnel down because we see the problems.
Go ahead.
And the problems we see are, one, if you try to put the onus on the convenience stores, good luck with that, because they're all self-regulating themselves. And if they're making a few extra bucks selling this stuff in the market, there's usually a financial incentive for them to keep doing it. And so for us having to chase and almost rely on their good honesty is a foolish public policy position. What we're trying to struggle with, I'll try to
Right.
redefine it a little bit for
Okay.
the commissioner, is that most departments of public health in the Commonwealth are now designed really mostly for tobacco control. And there are other substances, obviously, but any seizures, any investigations are usually about going in and buying flavored tobacco or something to that effect and then holding on to it. We are facing this prospect of potentially seizing entire stores if packages are drafted in a certain way. But our challenge remains. When you say that you put it on the onus of the store owner to test, when we finish, to test what's on their market, they're just buying product like Doritos and putting it into their store and saying, have at it, and saying, and playing dumb with us like we don't really know. And there isn't any regulation as to what is allowed, what isn't. And so we're trying to figure out, getting back to the chairman's question, is it really should be incumbent upon the state or the federal government to establish the rules and policies about this, and instead of making cities and towns go it alone, which we are having to do here in the city. And so I think of it as a fundamental lack of leadership, Mr. Chairman. No other way to put it. It's a major issue in communities, and that we're playing this catch-up game. So I don't want to put the burden on the store owners. And I also don't want to have it just prove whatever the product is described as and packaged, because I don't want to believe that either, or believe that they actually have the best intention of the general public when they're putting whatever the content of the package is on.
They are regulated. And if they're not regulated, they shouldn't be allowed to sell.
Well, who are they regulated by?
So any major manufacturer, to be a manufacturer, you are regulated to post correct information. If you're not, you would be fined or shut down completely. So that's on the manufacturer to be on the up and up, and it wouldn't be profitable to continue to do something that would get you shut down, right? So that's number one. If you're going to be a legitimate manufacturer, there was a list of vendors that was shared, and this was back, the FDA kind of approved this list here, and they said, these guys are doing the right thing in the green. These guys all need to be banned federally. And this was all over the news for weeks. And I was in the stores and I said, see all those guys? They're going to be gone, because 7OH and all those guys, they're not doing the right thing. These ones in the green, these whole leaf guys, they're doing the right thing. They're going to be here. The FDA is supporting this. And gave us this as a chart. And this was shared right at the beginning of fall to say, this is how we're going to start regulation. And this is a starting point to shut that funnel down, but we still have an opening. Now we got to squeeze that opening and get rid of as much of that 7OH as possible. But when we do this first squeeze, that's going to get rid of a huge portion of who's even on the market. And then, just like you regulate nicotine.
I hear you.
Yeah.
The issue is that there's money at stake.
Yeah,
The manufacturers are here to make money.
yeah.
So what is the incentive for the manufacturers unless they have to need to comply with the federal regulations, right? And anything inside the federal regulations they will comply with, but anything that they could skirt and escape around, they're going to do that.
Yeah.
And so I actually don't want to listen to the manufacturers in a certain light, because I feel like they have a vested interest to keep selling the product. They're making money, and if they can do it in a cute way, they're going to do it.
Right.
And if they're not going to do it for the benefit of the children or in protection of the children, they're going to do it to make money.
Yeah.
We're here to protect the children and protect the public safety.
And shut that all down.
If I can just quickly chime in, I'm in agreement with you that this is on the federal and state level and action is coming. The unfortunate side of it is that it is slow moving. And in the meantime, we can look at regulations. I think as a baseline, the 21 plus age gating is a fantastic starting point, because that just point blank limits, it significantly should curb the access of children, because there are, youths that can get these products fairly easily. And so we need, I agree that 21 plus age gating is probably the best step in that right direction. And then we can continue to discuss.
But is that done locally or statewide?
Plenty of localities do 21 plus age gating. So yes, that is entirely possible. And I will say I do know that there are Massachusetts, other municipalities, it's usually the tobacco inspector that goes in to make sure that these products are in compliance. And I'm happy to discuss this further and see what works.
Commissioner, you have hands on Zoom.
Yeah, I wanna though, before I get to the public comment piece, which I think both of those hands up are public, I would just want to make sure that those who are invited to be a part of the panel have been able to ask the questions they want to ask. So I'm going to go back to Dr. Colgram, hearing what you heard as far as the discussion is concerned. Do you have any questions or comments? And then I'll move over to Dr. White.
I would just say I think the article the gentleman was talking about, the one that I know of was the JAM article in 2024. That was a retrospective like survey. So it had a lot of limitations in terms of the responses from the participants, which I think was about 400, in terms of like they had good, responses to it. However, because of the limitations of when they did the surveys and how it was done, there left space for them not really explaining if they had any transient negative responses. So they're again kind of back to what Dr. Kresman is saying. Yes, it is a natural product, but it does have, there's a lot of kratom cravings in Asia. There is a lot of dependency on it. So I understand banning that, but I just want to make sure we are very much aware that there are risks to the natural kratom. And I think that we should make sure, like, if we do proceed with banning the 7-OH and continuing with the natural kratom, that we do make sure we're putting in education and risk warnings, big warning signs that's saying that there is a risk for dependency, because those are actually the reasons why, and Dr. Kresman can go into it, but those are the ones that have come to him. They weren't aware that there was a risk for dependency, and he had to treat those patients. So that's where a lot of that came from. And I don't know if you guys have ever been into these stores. I actually went in to the store this weekend just to kind of see what it looked like, and there's no signage anywhere. So that was like a really major thing that I think we should make sure that we take care of.
Thank you. Dr. White?
Hello. So a few things that that I heard today, I want to provide a little bit of additional nuance. So one is for most people, the effect may be somewhat like caffeine, but not for all of the people. So I think Dr. Kriegsman's right that there is a certain percentage, 3%, 5%, for whom the addiction potential and the negative effects on the people's lives are real, even with natural leaf kratom. So a lot of the people that are using it, maybe 60 to 70%, are using it in place of other substances, and those other substances have greater negative health impacts than the health impact of the kratom. But it doesn't mean that the kratom leaf by itself is a risk-free endeavor, right? And we don't want to say that it's better than in any FDA-approved products, because of course you should be using FDA-approved products to be able to treat your pain. If they're going to be effective, we should be using them for substance use disorder before we try to use something else. But there are some people that don't really have access to those products within the traditional healthcare system because they have high deductible plans, because they have no insurance, because they're homeless and they can't go and abide by all the things that you need to do and check all the boxes in order to be able to get those therapies, or they tried those therapies and those therapies were not successful for them. So this does give them another option outside of the illicit opioid market that a number of people are availing themselves to, and that believe that this is a product that's being able to help them continue to function in society. And the data that we have, even though it's not randomized controlled trial data, suggests that people are better able to maintain their abstinence for other products. They're less likely to inject drugs, and they're more likely to be able to care for themselves and their families than they are with other products. So I think, when you look at those things and you compare them against the 7-OH type products, the big difference is that the addiction potential in animal studies was very similar to that of morphine and very dissimilar to the effects of mitragynine, which is the main alkaloid that's in the leaf kratom product. When you looked at respiratory depression, the animal study showed that the mitragynine was not associated with dose-dependent reductions in the animal's ability to breathe, but that the 7-hydroxy product was very similar to that of morphine, right? And so that was shown in 2 different studies where they compared mitragynine and they compared morphine versus the 7-OH product. So I think the risk profile with the 7-OH product is much more like that of morphine. So not nearly as potent as fentanyl, but as a traditional opioid, right? So if you're not going to be selling morphine or oxycodone in a gas station, especially one that's blue raz flavored, right, you really shouldn't be selling those products onto the market. So it isn't whether or not I think you ban or you regulate. I think you need to ban some of them and then you need to regulate the others, because the others still have some inherent risk that you could reduce through the use of some of those products. And I do think the ordinance that you put together goes a long way in helping to make those things happen. So the people that were working on that behind the scenes, I think you did a really good job with a few small tweaks. I think you'd be where you would really need to be.
We have Stephen Howard. You
I'm
raised.
gonna go to Dr. Kriegsman first, if you don't mind. I'm gonna use the panel before I go to
Okay. Yeah.
I think Dr. Kriegsman is the last panelist person who needs to speak, and then we can go to the public, if that's all right with
That's
you,
fine.
Mr. Chair.
Yep.
Thank you. Dr. Kriegsman?
I don't really have that much to add. I really appreciate what Dr. Colgram said. I think, I'll just sort of summarize. I think folks are prone to oversimplify things in a way in these cases. I think there's probably some health benefit to the natural leaf. The natural leaf is safer than the purified products, and it's safer than 7-OH. It carries its own risks as well, but much lower than those. And so I'm not sort of here to sort of summarize what I think should happen politically, but I think that, the natural leaf product is significantly safer, and I think putting in sort of just educational and sort of warning materials where it's sold would be a great idea.
In the age.
In the age, thanks, yeah.
Thank you. Stephen Howard?
Thank you, Mr. Chair. Good afternoon, everyone. Very informative. Dr. White, you blew my mind with when you compared it to addictive drugs. Now, I'm sure folks here know about Rush Limbaugh and his addiction and where that went. He admitted he went in to get treatments at different times for the pain that he was suffering. So he was addicted to Oxycontin, and someone in that position could be so addicted. But then to have this thing available in stores where children could go in and purchase it, and their parents not knowing what it is they're purchasing, look, the same way alcohol is regulated, this should also be regulated. And I know we're running out of time, so I'll leave it right there. Thank you.
Thank you, Stephen. We have another person with your hand up.
Melody?
Melody? Yes. Can you hear us?
There we
You're
go.
muted.
I just had to unmute myself. Sorry about that.
Yeah,
I'm so glad that the chairman invited me to the meeting to speak about it. My involvement is I have been in the space since 2014. I am a 12-year consumer. This is my anniversary month. A 12-year daily consumer. And I was asked to speak at the July 29th the July 29th HHS and FDA joint briefing on kratom. They asked me to speak from their stage, and I was specifically asked to talk about the benefits of kratom and how it has changed my life, and it has, and to distinguish it from 7-OH. And they made very clear that they consider 7-OH the fourth opioid crisis. And I just kind of wanted to stick one thing in there from Dr. Christopher McCurdy. He is the one who's in charge of up to about $100 million of research dollars into kratom. I heard him say, and I quoted him, and it's on record, that kratom is so dissimilar to an opioid that it is a disservice to put it in the same class as an opioid, even though technically, because it interacts with the receptors, but then by that definition, you would also have to go that cheese interacts, which is why I eat so much pizza all the time. But anyhow, they invited me to the briefing, and they were very clear that 7-OH needs to come off the streets. And then the FDA commissioner and the president reiterated that about a week or so ago at the Great America Health and Recovery Initiative. They talked about 7-OH. The word kratom was never mentioned. And so I would just like to encourage you to get 7-OH off the streets now. The people that are selling it don't know that they're selling 7-OH. I keep an eye on my local gas stations, and I keep an eye on my local smoke shops to make sure that they're age gating and everything. I went to a smoke shop and asked for kratom. They handed me 7-OH.
wow.
That's not kratom. It's not. What? And so I took it as a teaching opportunity. And he said, I always thought there was something wrong with this because I had people coming in here buying 7-OH. They're spending a couple $100 a week. I always thought it was different, but I really thought it was the same. It was just a different strain or something.
Thank you so much. Judy, you had your hand up?
Oh, yes, I just wanted to make a quick comment. My name is Judy Torres. I'm a Springfield resident who's been using kratom and receiving benefits from kratom for about 10 years now. I'm 55 years old, Springfield resident, professional, and my interest here today was to join to listen about the regulation. My concern is for the adult access to kratom and the plant form, not the 7-OH, but the plant form. I've been using it. I have extreme pain from back arthritis, and I just choose to use kratom over opioids. And, because there's nothing else they can really do for the arthritis. It's going to be there for the rest of my life. But, I work a job. I don't consider myself an addict. I put a few spoonfuls of the plant in my coffee in the morning, and that's basically it. And so I'm just here to say that there are some responsible users, and thank you for letting me talk.
Thank you, Judy. Is there any, Zaida, do you have any final
Yes.
thoughts?
Yes, please. I just
Yeah.
so I'm just hearing a lot of alarming things. So when you get kratom, I guess you go to the gas station. That sounds weird to me. And then of course you're not getting kratom if you're getting the 7-OH. This is really alarming. And I think that I'm glad that the state has some legislation happening right now. And I like you, Counselor
Santinello.
Santinello, I'm hoping that the state will do their job, right, and push the legislation through, because at our city level, I know that Commissioner Carlton Harris is already overwhelmed with everything that we're having to do here. And if we're going to put another thing on her plate, we need money to go with that. And, our tax is already high enough. So I'm hoping that we're able to do something to prevent people from, overdosing and dying from this so that our city can be safer. And then at the same time, of course, if people need to use kratom, I'm hoping that there's another place to buy it besides the gas station. Those are my thoughts. Thank you, Mr. Chair.
Yeah, you're welcome. And I'll get on this right away tomorrow with our local delegation to find out where this is on the state level. But what concerns me the most right now is that people of any age can go in and buy this thing. And that's what's scaring me. Then they can go home and share it with their friends that are under 18. And that's frightening to me. It's very frightening. And I quite frankly can't believe how slow the state's acting on this. What are they waiting for?
Mr. Chairman, if I may, sitting here kind of listening to this conversation, since we're waiting, I think, on details on how to exactly enforce this at the local level, and as you said, funds are a concern. Is there any openness to passing right now a 21 age gate on all kratom products, and then look at passing a resolution urging the state to pass this through, especially given that, the legislature is currently meeting. Maybe we can kind of put pressure on them to move at the state level so we can look at regulation at a local level and hopefully get funding for it. Just a thought that I wanted to put out there.
Yeah, Helen, can we do that?
Yeah, I think we can go forward with the 21 age, have conversations with the law department, Counselor Santinello, on that, and then look at the other regulatory processes that need to be enforced.
Okay.
But we would start with the 21 so that I quite frankly would love to get 7-OH off of our shelves in the city of Springfield. I mean, that's really a concern. Right now, there are no regulations, but again, testing concerns me and enforcement concerns me. I do not like ordinances that are not enforceable. That's where I stand with it.
Yeah.
And certainly, Counselor Santinello, we can have that discussion with the City Council, Health and Human Services Subcommittee, including Counselor Goban.
Yeah, and thank you, Commissioner Carlton Harris, because that's a very important point. So I'm wondering if the solicitor can answer, are we able to just ban it right now in the meantime until we find things out? Is that something that we can do?
Well, the commissioner, he left.
He left, okay.
The solicitor left, but I can find that answer out after the meeting.
Let's do that. Let's find out if that's something that's possible, because
Yeah, I agree with that.
Thank you.
Yeah. Anybody else from the committee?
Dr. Colgram.
Dr. Colgram?
I just would also want to include any type of actual labeling in the store. Because like I said, there is literally nothing.
Yeah.
At all.
Yeah,
So
if it's
you
going to
wanna
be
include
sold
that as
there.
well.
Yeah, if
Like,
it's going to be
risk of
sold there.
dependency,
Right.
something. The only
Some
labeling I saw at the store was like for the no flavor tobacco signs, because I literally just walked in the store just to kind of see what was there. That was like the only thing.
Some vendors have led by example and they've put 21 plus stickers on their product. And this was shared earlier at the end of 2025. It was a list and the FDA supported it. There was a QR code. I could share it. Everybody can go to the site and see that in the green area, these were all 2% or less. And some of these are already leading by example, putting 21 plus. The ones on the left that are in the red, those are all above 2% and are recommended to be banned nationwide.
Sure.
So this is a good starting point of list of vendors that are already approved or not approved. Start with that, store by store, whether it's whoever that goes around with nicotine could use this sheet right here. Say the FDA has already recognized this. This is a good starting point.
If I may as well, the state of Utah has a regulatory thing in place, and they actually have a public list of like 55 products that have been third-party tested and gone through their approval process. I can give you a list of those if that's the direction you want to go in. But I still agree with you. Like we all agree 7 needs to be banned. It's a matter of how we do that and utilize the resources available to us. And I'm happy to be that resource alongside everyone else and see what we can get to make sure that the public is being protected from these substances.
I'd like to thank everyone for being
Can I-
here today, and we'll have a follow-up.
Can I
After I-
just say something? real quick?
Excuse me, Stephen, excuse me. Hold on one second. Until I have a chance to talk to the law department with Zaida Gavan, who's a member of the committee, and Helen Calton. Yes, Stephen.
Two things. First off, I'd like to thank both councillors and the commissioner for bringing this to the attention of the public. And second off, I believe it was last year, you passed, the city council passed legislation on candy cannabinoids. And I think that could be one thing that could also be done in this instance so that the city will start protecting, especially its children from exposure to this and possibly addiction. But I think that's one thing that you can focus on, and then the state and the federal government could come in and do what they want to do later. Thank you.
Thank you, Stephen. And I'd like to thank everyone who participated today. And again, thanks. And this meeting is concluded.
Thank you very much.
Thank you,
Thank you
everyone.
all.